Rave reviews for a senior Conservative politician in the Daily Mail today. No, not him. Rather, Health Secretary Sajid Javid quotes, "In an invigorating blast of common sense, Mr Javid has promised to slash the number of NHS diversity and inclusion managers with his radical reforms." Here to explain more is Health Secretary Sajid Javid, who I believe joins us from a central London hospital with me now. We'll talk more about why you're at the hospital, but a little bit more of this has excited one of the newspapers. What is it that you plan, Mr Javid? Good morning.
Good morning. Look, today what I'm announcing is the biggest shake-up in leadership in NHS and care that we've seen in a generation. This is off the back of an independent review that was done by General Sir Gordon Messenger, and what he identified is that we're putting billions into NHS and social care, especially after the pandemic, and we've got to make sure we have the very best, consistent leadership across the NHS so that we get the best possible patient outcomes and every pound is spent wisely. And in this report, it talks rightly about examples of really fantastic leadership. I see examples of that almost every day in my job, throughout the NHS. But it also identifies, poor leadership, especially in some of the most challenging areas, most challenging regions. And so it comes up with a number of recommendations about how we can replicate good leadership. It also gives evidence in the report, sadly, of examples of poor behaviour, of a bit of a blame culture in certain cases, and of course that's unacceptable, and gives recommendations about how to tackle that. So I'm going to accept all its recommendations, and I know that it will lead to the most important thing of all, which is better patient outcomes.
We want that, and as you referenced earlier, Secretary of State, we want value for money. How confident are you that you can get to a position, noting the budget that you're dealing with, north of, I think, £150 billion, how confident are you can ensure that every pound is well spent within the NHS?
Look, that's my aim, and I know to do that, obviously a number of things need to happen, but leadership must be right at the top, because that money, that funding you're talking about, it's some £160 billion this year. That's bigger than the GDP of Greece. That's how much we're spending on the NHS. Now, we're doing that because that's what the NHS needs, but we will get a lot more out of that money if we make sure that it's being spent wisely, and good leadership is going to be absolutely key to that.
Just explain, if you would. You've said they want the NHS to be more like Blockbuster than Netflix. You'll be aware you've attracted some criticism.
The wrong way round.
Well, is that because that's what's been reported in one of the newspapers? You wanted to be more of a Blockbuster organisation?
No. I think that was probably reported somewhere. But what I've said is that.
Well, what is the Netflix suggestion?
So what I'm talking about is modernisation. For those people who remember Blockbuster, the video chain.
That would be the video chain that collapsed in 2010.
Do you remember Blockbuster?
Yes, it collapsed in 2010, Mr Javid.
Exactly.
£584 million in
Why
debt.
did they collapse?
80,000 people globally lost their jobs. And I have a note in the Daily Mirror that you're referencing the NHS to that. So it's your opportunity to put them straight.
And that's because what I'm talking about is modernisation. So the Blockbuster chain eventually, it didn't do well. It collapsed because it didn't modernise. It didn't see the latest trends, the latest technology. It didn't adopt them. It didn't survive. I want our NHS to always be there, free at the point of use, paid out of general taxation, providing us the very best possible healthcare. Now, to do that, we need an NHS that is looking out and modernising towards sort of 2048 rather than one that's got the values of 1948. And that means that we need to make sure that the NHS is staying on top of the demographic changes we're seeing. More people living longer, which is great, but they have different types of health needs. We're looking at the burden of disease and how it's changing. We're adopting the latest medicines and also, of course, the latest technology. And we started this, but I'm at Chelsea and Westminster Hospital.
Right.
This hospital, it has electronic patient records. Not every hospital does. And that's the kind of modernisation, just one tiny example, that we need to see across the board in the NHS to make sure that we're going ahead with the changes that are needed to give the very best service for the future.
But Netflix, you say you want the NHS to be more like Netflix. That's wholly American-owned, and you have to pay a premium to enjoy its programmes.
Well, I'm talking about technology. I'm talking about the improvements in terms of modernisation and technology.
Do you think, with hindsight, it was perhaps a bad example to choose?
No, I don't. I think that people understand that modernization, if organizations, whether they're private organizations or public organizations, if they don't see trends and changes around them and don't modernize and adapt, then they won't survive. And I think we all want our NHS to be as strong as possible. We want it to be there, free at the point of use, paid out of general taxation, and we want it to offer the most modern services. That's what I think everyone will want to see.
As a senior member of the government, perhaps while I have the benefit of you on the line, I could ask you a couple of other questions. There are concerns, Secretary of State, that the price of a litre of fuel will go above £2, this for both diesel and unleaded. Indeed, as a prior Chancellor, you will know that 5p cut in March does not seem to have found its way to the consumers. Where did it go, and what can be done to stop a £2 a litre fuel?
Look, I mean, first of all, I completely understand the cost of fuel and how it's hitting many people, workers and others, and I understand that. And that's exactly why the Chancellor made that 5p cut that you refer to. When you say
I didn't get it, did you? I didn't. I haven't seen it when I fill up.
I think since that time, I think I'm right in saying the price of oil, certainly a barrel of oil, has continued to rise, sadly, because of the tensions that we're seeing because of the war with Russia and Ukraine. And these are global factors. Of course, they're outside the control of any single government, but it's right that we respond in any way that we can afford to. That 5p cut was important, because if it hadn't happened, I'm sure the price would be even higher than it is today. It is important that the government keeps looking all the time to support people with these challenges from these global trends, whether it's on oil price or energy price. So, for example, the £22 billion of support on energy bills, I think that's equally as important, and it's something I know that the government will keep under review.
One newspaper today, we've referenced a couple of them, this one is the Daily Telegraph, leads with the story, Johnson, as in Boris, urged to make Hunt, as in Jeremy, Chancellor. Good idea?
Look, decisions around the cabinet are decisions for the Prime Minister, and obviously this is just another example of some speculation that's out there. I think the most important thing is this vote of confidence has happened. When you and I talked last, or just a couple of days ago.
Yeah, Monday it was,
Monday.
Yeah,
it hadn't happened. Now it has. We've got a clear and decisive result. And the most important thing now is to sort of end this kind of speculation, just get on with the job. I've got an important job to do in health and care. All my colleagues have important jobs to do, and I think that's what everyone wants to see.
And does Mr. Hunt have the skill set to be a Chancellor, in your view?
It's not that. I've got a lot of respect for all my colleagues, including Jeremy Hunt. But what roles they may or may not play in the government, that's not a decision for me. That's a decision for the Prime Minister. Lastly,
do we have echoes of the 1970s? I appreciate you probably weren't even born, but it was a time when we had a lot of strikes on issues such as the railways and elsewhere. There was soaring inflation. There was a huge cost of living crisis. The government taking us back to those dark days?
No, I'm very concerned. You're obviously referring to the reports today about the rail unions.
Yes.
I'm very concerned about that. It's not only bad for travellers and the misery that will cause, but I actually think it's going to be bad for the workers themselves, because this is not a way to work together and to build a sustainable sort of rail industry. We know during the pandemic, obviously, that industry, like many others, was really challenged. That's why the government put in, I think, some £16 billion of extra funding. That's something like £600 per household. That can't be sustained. And so there needs to be changes. And the best way to deal with this is to, for all sides to basically become grown-ups, get round the table and talk.